It's 10:01, and I think we probably are about ready to start our webinar today. We have 35 participants joining us already, and I'm sure we'll have a few more. So let's get started. Thank you so much for being with us today. My name is Betsy Cooper. I am a member of the League of Women Voters of Kitsap, who is bringing you this presentation today, which is the Climate Change in Your Health, Prepare Now. As I said, the League of Women Voters is presenting this to you today, and we're recording this session, and it'll be available on our website, which is listed in our chat already, in probably about 2 weeks. So you could watch it again or share it with others if you'd like. We also, this is one of a number of programs that we're putting on, particularly in relation to our environment. The next one is on April 21st, and that is called Plastics, the Big Picture, Local Insights and What You Can Do About It. And you'll notice that's during Earth Week. So hope you could join us for that one as well. And a little bit about the League of Women Voters. The League was founded about 100 years ago in the days of women's suffrage movement. The League envisions a democracy where everyone has the desire, the right, and the knowledge and the confidence to participate as an educated participant in our government and our democracy. The League welcomes all persons of all genders. It's not just the League of Women Voters. And the League is nonpartisan, but we do take public policy positions and advocate for them after we study them thoroughly. You can learn more, again, if you go to our website, which is in the chat. Before we begin today, I want to also acknowledge that most of us are sitting today on lands that were traditionally lands of one of the tribes of the Coast Salish people. You know, we're all sitting in different parts of the Seattle area and maybe not even other areas today. So please consider for a minute the Native peoples that formerly inhabited and used the place that you called home today. Thank you. Now let's begin our webinar. We are so pleased to have two special speakers joining us today, Dr. Christy Ebi and Lauren Jenks. And what we'll do is we'll have these two speakers speak. Dr. Ebi will go first, then Lauren Jenks, and then we'll have a question and answer session. And the way that will be done is that you can put your questions during the presentations in the chat, type them in the chat, and then we'll do that question and answer afterwards. And all the attendees will be remain muted because this is a webinar session. One other thing I just want to mention is that you can see in the lower part of your screen, there's a live transcript button. And if you wish to have that live transcript showing, you just press that button and you'll be able to see that, or you can turn it off if you wish. So let me introduce our speakers today. This first speaker will be Dr. Christine Ebi. She is an epidemiologist with primary focus of studying the impacts of climate change on human health. She is a professor of global health and environmental and occupational health sciences at the Department of Global Health at the University of Washington. And our second speaker will be Lauren Jenks. She's an assistant secretary of the Environmental Public Health at the Washington State Department of Health. She is passionate about our public health and environment and racial equality. So again, please just put your questions in the chat as you listen to the presentations, and after the presentations, we'll do questions. Now, let me introduce Dr. Ebi to begin her presentation. Thank you.
Thank you very much. I really appreciate the opportunity to talk with you. And I really appreciate all of your interest in learning more about climate change and how it is affecting the health of Washingtonians. I will start with a little information on climate change. I understand you all know quite a bit about climate change, but there's a few things that are pretty important when we think about what this means for our health. And then I'll go through a wide range of ways that climate change is affecting the health of Washingtonians to set the stage for further discussion about what the state is doing, which is quite a lot, to try and protect all of us as the climate continues to change. I assume all of you have seen the climate stripes. If you have not, they're a mechanism to help communicate how much climate has changed since pre-industrial times. As you can imagine, when you look at this, that the colors have to do with whether temperatures were cooler or warmer compared with the baseline of 1971 to 2000. So needless to say, pre-industrial temperatures were much cooler than they were in 1971 to 2000. And today, of course, they're much hotter. Something that's important, particularly here in our state, is that these are global mean averages, temperatures, but it doesn't look the same everywhere. So you can see there's not as clear a pattern here in the state of Washington. And so when you think about climate change, we do talk globally about what is shifting. The local changes can look a little bit different. So you can see that as you look towards the right, that we are getting warmer as a state, consistent with what we're seeing globally, but not at the same rate as we're seeing globally, although at the far right, it looks like we really are starting to shift our temperature patterns. I'm going to show a few stills out of a video I took off the NASA website to illustrate a couple of other issues. In these stills, the baseline, instead of the baseline for the stripes is 1971 to 2000, the baseline for this is 1961 to 1990. Climatologists like to shift their baselines, which I can talk about later if you're interested in it. And this is just post pre-industrial. Industrial revolution has started. Humans are putting greenhouse gases into the atmosphere. And you can see in the upper left, the temperature scale, and these are in degrees Celsius, going from -2 to +2. As you would expect, in pre-industrial times, temperatures were much cooler than they are today. This is 100 years after the last figure, 10 years, and another 10 years. 2 points on these slides. The first is the rate of climate change. It's hard to underemphasize how important the rate of change is. The climate is changing faster than it's changed in more than 10,000 years. And that means, for as hard as scientists are working to understand climate change, understand what it means for ecosystems, for health, that we may not be capturing the consequences of these very rapid changes in temperature. The other you can see is very uneven patterns of warming. And I illustrated that in the climate stripes as well. So just because we're seeing large changes globally, we're seeing a complexity of patterns underneath that. These kinds of issues are, in my opinion, pushing public health in a new direction. That, as we've seen, particularly with COVID, when a problem arises with public health, research is done, people figure out what to do, and in this case, a vaccine is distributed to everybody. When you think about the problems of lead and lead exposure in gasoline or lead paint, studies were done, exposure-response relationships were established, and the same exposure-response relationship was applied everywhere. This doesn't work with climate change because the climate is changing everywhere, but it's not changing exactly the same everywhere. And therefore, what we need to do needs to take into account these physical changes in our climate system. And as I'll show you throughout this talk, also need to take into account the local context. So the complexity of how issues are managed in health and in all other sectors with climate change means that there has to be really much better collaboration, coordination, and co-production with local communities to make sure that the kinds of adaptation mitigation options that are implemented are going to be effective in that place. You've seen various versions of this slide. This is from the Intergovernmental Panel on Climate Change, looking at the consequences of warming of 1.5 versus 2 degrees Celsius, and just shows you how climate has changed since pre-industrial. The gray line here is pre-industrial temperatures, showing you in the red the actual temperature changes, global mean surface temperature changes. In the gold, the range around that, the confidence around that, and the near-term projections. And you can see very clearly sometime around 1970, 1980, there was a shift in the slope of the curve. And that is what I was showing you before, that we're on this different trajectory than what was experienced previously. Much more rapid climate change. The other point that is of interest to me particularly is when you look at this curve, one of the implications of this is anyone born after about 1980 has never seen a normal climate. For those of us who were born well before 1980, we think about the climate we grew up with, we were comfortable with the climate, we know what to expect. But certainly my children were born after 1980 and they don't know what normal is anymore. And I think we need to take that into account when we're thinking about how to interact with the youth activists who are so impassioned and are really doing a lot to push the climate forward. They're coming from not climate forward, climate change action forward. They're coming from a different perspective that we need to understand. You know, temperatures are going up. These are the records in 2020. We fortunately didn't have any of the top 10 hottest or the hottest on record. It's only a matter of time. So we've been lucky. We're not going to continue to be lucky. It's not just average temperatures, it's changes in the extremes. The figure on the left is the kind of figure that scientists show traditionally about what's happening with our extremes, where you have these normal shaped curves that as global mean surface temperature increases, the average goes up, the shape of the curve stays the same, and you see a big increase in extreme heat. What the observations tell us, though, is a bit different. What's happening is that curve is flattening and moving even further out to the right. So we're seeing a very large increase in extreme heat. The figures on the left are some work that was done for different Intergovernmental Panel on Climate Change special report. And in this, the climatologist looked at 26 world regions over the period 1985 to 2005 and looked at the one hottest day of the year. And then in the various time periods you see on the left for June, July, and August, JJA, or the opposite, of course, in the Southern Hemisphere, under moderate emissions or under high emissions, and ask the question, how often would that one hottest day in the 20-year period occur? And you can see under RCP 8.5, which is high emissions, which we've been under, unfortunately, you can see that parts of the tropics, that one hottest day in the year is now occurring on average every year. By mid-century, we're going to see large parts of the world where that temperature, that one hottest day of the year in 20 years, is going to be occurring very regularly. We don't want to go to high emissions, but even under lower emissions, we're going to have very different temperature patterns. And that has consequences not just for our summer heat, but for what's going to happen with humidity. And I'll talk about that in a moment. When we look at the changes in our climate, what this means for our health, one resource I'd recommend you taking a look at is the National Climate Assessments. The fourth one came out a couple of years ago. The fifth one is just going to get started. And you can see in this figure, we've got various climate drivers. I spoke about a couple of them. And when we think about what the health outcomes are, it's not just the changing climate, but it's the environmental, institutional, behavioral, and social context. Racism matters. Redlining matters. There's lots of reasons why heat-related mortality, for example, is higher in particular places. And it's not entirely due to our changing climate. So we need to understand these complexities of other factors that affect our health and affect the extent to which we're exposed, susceptible, and vulnerable to a changing climate before we can be effective in our interventions. We know that exposure and resilience vary across populations and communities. This is another figure from the National Climate Assessment, just illustrating some of the communities we know that are more susceptible to a changing climate, the reasons why they're susceptible, and some of the options for helping reducing that susceptibility. And I'll talk about these throughout, but this is just a nice summary graphic. Sorry about that. One point I wanted to make is I've talked about this increase in extreme events. NOAA, the National Oceanographic and Atmospheric Administration, has for years been tracking billion-dollar disasters in the US. And these are disasters that, in this case, in 2020, there were $16 billion disasters between January and September. We're not talking about million-dollar disasters. We're not talking about smaller disasters. We're only talking about the major disasters. And in 2020, those billion-dollar disasters cost the US economy something in the range of $250 billion. And so if you hear people say that we can't afford to mitigate, we can't afford to reduce our greenhouse gas emissions, we can't afford to pay for the consequences. And to think about what those consequences mean and what the costs are for people's livelihoods, for their homes, for their communities, and ultimately for our health. And so we do need to make sure that as we go into an even different climate that's going to be different from what we have today, we're better prepared for these extreme events. Something quite close to the heart of all of us are wildfires. So you can see on the left, the acres burned across the Western states, see the very large increase in Western states. On the right, you see some of the risks of exposure to wildfire smoke. I'd like to point out that the air quality index goes up to 120. During last summer, where I live, the air quality index was about 250. Most of Seattle had incredibly high air quality problems. And this is when the city started thinking about how it's going to address the challenges of pretty low penetration of air conditioning in Seattle. And when we have very high temperatures, often that coincides with when we have wildfires. And when you think about what you can do, what messaging is possible, when you have wildfires, of course, you want to tell people to close their windows and doors, to try and keep that air pollution outside the house as much as you can. But at the same time, if it's really, really hot, what you'd like people to do is open their windows and doors and get good air circulation. The city is now going to be opening shelters when this happens in the future, so there's places for people to go to. And that is one effective option as long as we can get the people who are most vulnerable to those shelters. We've seen flooding. There's lots of focus recently on flooding. And one health impact I'd like to focus on with flooding, not the obvious ones that you all know about, but the figure on the right about mental health. Some very good research is being done in England. There was massive flooding in an area of England in the year 2000, and they've been doing follow-up from that in terms of the mental health impacts. And you can see the big differences between people who are flooded, who were disrupted, but their houses were not actually flooded, and the baseline. And see the huge increase in depression, anxiety, post-traumatic stress disorder. Follow-up from this particular area shows that there is still, several years after the event, higher rates of probable depression and anxiety in people whose houses were flooded. So these are long-term consequences for our health. There's lots one can do about heat. There's lots that is being done around the world in developing heat action plans. One key element of a heat action plan is to have a heat wave early warning system. These are a variety of posters and headlines related to heat action plans, so that it is possible to make sure that people are aware about increased heat. Our meteorologists have much greater skill in telling us when a heat wave is coming. And with much better education, people can understand what it is they need to do to reduce their individual risks and to reduce the risks of their family and their friends. And so this is an area where our temperatures continue to go up. There's going to need to be greater focus here in King County and throughout the state because of high temperatures and what that means. I want to add that no one needs to die in a heat wave. There's been big heat waves. There was big heat waves in Europe in 2003, almost 70,000 excess deaths across Europe. A few years later in Moscow, massive heat wave, 50,000 excess deaths. They can be prevented, and we need to take steps so that we're proactive and we're ready for when we have these very high temperatures. I showed you the figure before that 2020 wasn't remarkable for us. Again, it's going to happen at some point. I also want to highlight again that discrimination makes addressing these issues even more difficult. Redlining is a problem with long-term consequences. The communities that were redlined have fewer trees, they tend to be a lot hotter. And so we need to make sure that whatever interventions are put in place, what we do with our heat action plan addresses the needs of the most vulnerable. Thinking more about heat, this is some work that was done here in the state, looking at advanced life support calls to emergency medical services between heat and not heat days. And you can see this very large increase in number of calls. We are being affected. The people who are most at risk are adults over the age of 65 and people who are living in poverty or people who are living in these marginalized communities where redlining occurred. We also need to think about our workers on the eastern side of the state. This is work that was done by June Spector at the University of Washington, looking at the number of worker days as we go into a warmer future where workers will be working in unsafe locations where it'll be too hot to work. And you can see, by and large, we're okay today, but as we get to 2 degrees above pre-industrial, and if we get to 4 degrees above pre-industrial, which could be possible at the end of the century, a huge increase in the number of our orchard workers who are just going to be unable to work because it's going to be too hot. So lots of very severe consequences are possible within our state as the temperatures continue to rise. And there's lots that can be done to be prepared and ensure that we don't have these high level of risks happen. We might not be able to prevent the number of hot days, but we can prevent the number of people who are affected in those hot days. Allergies are a problem. I'm sure everybody, usually if I'm in a classroom, I ask how many people have allergies. It's usually a fair number of people have allergies. There's been lots of research showing that as temperatures are going up, our summers are getting longer, spring starts sooner, fall starts later in terms of the temperature. And that means ragweed is pretty happy. So the ragweed season has lengthened. You can see up in parts of Canada by almost a month. So welcome to more allergies. You can see on the top right that as carbon dioxide goes up, there's also more pollen production from grass. So very large increase in the grasses and their production of pollen. And the bottom right, we don't have poison ivy here, but it's the same idea that as carbon dioxide increases, that some of the plants to whom we react will become bigger. They're going to have, in this case, more toxic oils in them. So there will be impacts on our allergies, and that will be, of course, significant for people who've got asthma, COPD, or other chronic lung disease. I'm not going to go through this, but a favorite topic of everybody's is vector-borne diseases. This is just in here because you can see temperature and precipitation are central to the development, the survival, and the reproduction of mosquitoes. They're also central for many of the other vectors like ticks. And so there's a large area of research in climate change and health looking at a variety of diseases that can be carried by mosquitoes. One of particular importance is dengue fever. It is carried by a mosquito called Aedes aegypti. And we'll hear a bit later about the tracking the state has for making sure we know when that mosquito is here. And this is some work projecting where Aedes aegypti could move to. It's currently in the buff colored area on the left. It's throughout, we know it's in Florida, we know it's in parts of Texas, but frankly, the monitoring for the mosquito is not consistent from state to state. So the buff colored area are based on environmental data of what we know about this mosquito, what it requires to be able to survive and replicate, and applied that to the temperature precipitation patterns across the US. And so when you see the present day suitability, it's in the buff projection for about 2070 or so, you can see the expansion in the red colored area. And you can see very clearly Seattle's part of that we could easily have this mosquito by 2070 in Seattle. The right-hand figure, though, shows when will the temperature precipitation patterns change so that we have summers that are long enough and hot enough that if you introduce this disease, dengue fever, into a mosquito, that you can actually have transmission. There's a really complex cycle within mosquitoes. When they bite somebody, it's only the females that bite. When the females bite somebody, they pull the virus into their mouth. It goes down to the gut, and the virus replicates in the gut. The rate at which it replicates is temperature dependent. And so you have to have a long enough period for that virus to replicate. And that period has to be consistent with the length of the life of the mosquito. So complex interactions. And you can see on the right-hand side that Seattle's safe, state of Washington safe, that at the end of the century, towards the end of the century, that we'll see the mosquito having changed its range, but we won't really see much in the way of dengue fever outside of the southeastern parts of California. However, in 2017, this mosquito, breeding colonies of this mosquito were found in Toronto, Toledo, and Detroit. So as is happening in other sectors, we're under projecting where we might see this mosquito. We're under projecting, therefore, when we might see dengue fever change its range. It's now become an issue not of whether dengue fever could show up in the state of Washington. It's more a question of when. And there then becomes lots that needs to be done in terms of thinking how, with constrained budgets, our Department of Health can think about when starting to do the monitoring for this particular mosquito would make sense. I should point out this mentions Zika on here. This mosquito carries not just dengue fever, but carries Zika, chikungunya, and yellow fever. But putting this all together, I didn't go through all of these issues. This is a figure we put together at the Center for Health and the Global Environment, showing in the center some issues about climate change, rising temperature, extreme weather, rising carbon dioxide, rising sea level. Around that are factors, as I showed from the beginning. It's not just that the climate is changing and it directly affects our health, although heat does directly affect our health. It's how it interacts with a whole range of other factors. Outside of that, then, are some of the exposure pathways that are important for our health, starting with extreme weather, changes in vector ecology. And you can look around and see the others I could have talked about that I didn't today. And then outside of that is a list of some of the health outcomes that are likely to be important as the climate continues to change. If we look towards the lower left, we've got Vibrio perihemolyticus, a very nasty shellfish poisoning that currently causes several thousand cases a year, probably causes several thousand cases per year in the state of Washington. It's often not diagnosed. But as the water quality changes, we might see an increase in that. And so you look around and there's a whole long list of issues that we need to start thinking about, need to start preparing for, and finding ways that will work with our culture here in the state of Washington to make sure that whatever we put in place will be useful, usable, used, and make a difference in the health of all of us. So thank you very much. I really appreciate you listening. And I look forward to questions later.
Thank you so much, Dr. Ebi. Very interesting and very thought-provoking. All right, we should go on to our second speaker, Lauren Jenks. Please go ahead. Thank you.
Thank you. Good morning, everybody. I am not as slide heavy as Dr. Ebi was, but I do have a couple of things right now. And, you know, the first thing, being in public health, that I feel like I do need to talk about is the current pandemic that we're in and how much that has impacted the whole world, right? Like I titled this Climate and Change. The climate is changing, but we're right now in the middle of so much change that, you know, we're not going to be able to address the climatic issues without really dealing with some of the changes that we've seen so far. And I think some of what we have learned from the COVID pandemic is really relevant to dealing with climate change. We know a lot more today about the systems that we need to maintain in order to rapidly and effectively respond to the next crisis, right? We know about new partnerships that we need to make sure are solid, and we have new ways of doing things that really have allowed us to scale up disease reporting and testing supply and distribution and carry out our public education campaigns and much more. And we've learned so much from that will be relevant to how we respond to small and large disasters that are related to the climate. You know, I think we've also learned about new ways to connect with each other, right? We know now for sure how devastating it can be to be isolated and lonely. And we've learned how to use Zoom. We've learned how to FaceTime. We've learned how to connect and support each other remotely. And I think strengthening those relationships with our neighbors and our friends and our families helps us prepare for the next crisis. And it helps to develop that community capacity that's really needed to address our climate issues. And wow, have we seen health inequities in the COVID pandemic? And these are inequities and unfairnesses that we know we're going to see as we continue to address climate change. And we've seen it up close and personal here, even right now, trying to get vaccine to people. We know that how likely you are to get that vaccine is influenced by how much money you make, where you live, your underlying health and mental health and well-being, your job, your race and ethnicity, all of these things that should have nothing to do with whether you have access to a life-saving vaccine. They do influence the health and our distribution of resources in this state and certainly in the nation. The pandemic's certainly not the first crisis to demonstrate that, but it is our current one. The other thing I think about is misinformation. We have seen so much misinformation out there about COVID-19 and how it's spread and how masks are effective and whether there are treatments, and misinformation about the vaccine. And I think we need to study that and learn from that, because as you all know, there has been plenty of misinformation around the climate crisis and climate change deniers and things like that. Learning how to address misinformation in an empathetic and respectful and helpful way is super important for the COVID-19 pandemic and very important also as we address climate change. I kind of think of us as heading into an eye of a hurricane, right? Like we've been super focused on COVID-19 as more and more people get vaccinated. We're in this race, right, between the vaccine and the variants right now, but assuming the vaccine can pull ahead and we'll have this lull where we're trying to get back to normal. It's in this moment that we need to think about normal and what it is that we kind of liked. I mean, maybe sometimes we like Zoom meetings and we don't have to travel as much and pay the environmental cost of that travel. Maybe there are some things that we should keep into the new normal, because that, you know, the eye of the hurricane, we have a little bit of calmness and time to think, and then we are rapidly staring down some serious disruption and disasters that we're anticipating from climate change. So taking advantage of this time to learn from the pandemic, learn how to address this misinformation and apply it pretty quickly towards climate change. I think it's going to be an important bit of work that we all can participate in. If you remember nothing else, here is the short version of my talk today. Climate change is happening. It's really bad, and Dr. Ebi has taken much of the heavy lifting on those 2 points for me, so I super appreciate that, and really will focus a little bit more on what we can do about it, either as individuals, as communities, as people who are involved in organizations like the League of Women Voters, or in our government. We'll talk a little bit about what Department of Health has been doing in thinking about these solutions, right? This new normal, right? These changes that we make to protect the climate, they make our world a better place, right? These things we do to save the world create a world that's worth saving, where we have good connections with our communities, where we know and love our neighbors, where we're breathing air that's clean, where we're out on our bikes more and getting more exercise and enjoying the outdoors more than we can now with some of the other issues that we have going on here. That's the short version, right? Y'all gave me about 20 minutes, and so I will give you the longer version here, but also because I'm delighted to be talking about climate change. I think it's really important that we do talk about climate change out loud with everybody, even if it's a little bit awkward. And I certainly have had those awkward times. I remember talking to my husband's cousin who lives in Spokane, and this was in the summer, and they were having a really rough wildfire season east of the mountains. And she was telling me about going outside, and it's literally raining ash. And then 15 minutes later, she mentions about, you know, some of those liberal people and what they're talking about with the climate and, you know, just sort of disparaging of all of that. And I'm dumbfounded because you go outside and it's raining ash, but you still are not really seeing the connections between that and climate. But I didn't say anything because that's my husband's family, and, you know, maybe I can just be polite and not controversial and you know, get through today. But, you know, now as I think about that, I kind of regret that, because I think we need to, all of us, try really hard to resist that impulse to kind of put your head in the sand and avoid bringing climate up because somebody might find it controversial or depressing, you know. But like we've got to be brave enough and smart enough to have these conversations empathetically, productively, and ultimately because we've got to work together, all of us, to protect the planet. Like many of you, I care about our climate and I care about our health, and climate change affects both of these things, right? And Dr. Ebi did such a great job going over these things for us. But, you know, severe weather events lead to injuries, terrible losses, fatalities, and then lasting mental health impacts from that fear and trauma. Air pollution from wildfires worsens asthma and cardiovascular disease. Those changes in mosquito habitats can lead to more mosquito-borne diseases, including some of the ones that Dr. Ebi talked about: dengue, Zika, West Nile virus. And when we have those high heat days, right, they do increase that risk of heart heat illness and aggravate chronic conditions that people may already have, like heart disease and diabetes. And heart disease and diabetes are already leading causes of death right now. And as we have heat days, that just puts a huge portion of our population at risk. Climate change right now is also making it harder for public health systems to do the things that we need to do to protect health. Heavy rain events and flooding increase the stress on our drinking water systems that provide safe and reliable water for us to drink. And those systems are what prevent us from having waterborne diseases. As we stress those systems, we really look at having some real struggles in the future. We look at sea level rise potential, storm surges right now, heavy rainfall, flooding again, increase the stress on our wastewater systems, including our septic systems and our city sewer systems. And when these systems fail, they pollute lakes, they pollute our seawater, they pollute Puget Sound, and they increase the risk of us all getting some of these waterborne diseases, and they deteriorate our recreational beaches and contaminate our shellfish. Climate change also matters to me as somebody who values fairness, right? There's nothing fair about climate change. In this country, it's the very young, the very old, people without health insurance, historically marginalized communities, and those who live in poverty, who are the people who will be affected the most. And internationally, the worst impacts of climate change have been to countries with less stable infrastructure. So the impacts are worse to the countries that pollute less. Rich countries that pollute more, countries that have more resiliency to the impacts of climate change, is us, right? So it's these rich countries that need to disproportionately reduce our carbon footprint, so that the poorer countries can build infrastructure, things like roads and schools and clean drinking water. We're the ones that have more resiliency and more ability to pollute, and we therefore have more responsibility to carry some of this burden. And of course, the unfairness isn't just at the global level. As our population grows older, we have more older adults who are more at risk. As our population grows more diverse, and we know that many of our communities of color carry a disproportionate burden of health conditions like asthma that are sensitive to the climate. We see already that among our high school kids, it's kids who are African American who report having the highest rates of asthma. And that's today. And among our adults, as we survey our adults, it's people who are American Indian and Alaska Native that have the highest rates of asthma. So all those things like pollen, wildfire smoke events, longer air stagnation events that create more days in the year where we don't have healthy air quality, those issues create the biggest burden for our people who have asthma and other heart and lung conditions, which we can see are our communities of color. So these issues don't affect everybody fairly, right? Even though, we all live on the planet, it's not something that all of us have the same responsibility and the same impact for. We talked a little bit, I think, about climate models, and most of these models that we work with go through to the year about 2100. And those results show that global temperature will continue to increase, but also show that our decisions and our behaviors that we choose today determine how dramatically the climate will change in the future. So what that means to me as a mom of 2 kids who will be around hopefully for quite a while here is that they will see the results of the work that we do today. And it's quite literally determining what kind of world do we want to leave for our kids. I'm going to put a poem in the chat here for you. It is one of the, I would say it's the only poem that I have ever read about lead poisoning. Not a topic a lot of poets write about, but Mary Oliver has written about lead poisoning. She tells a story of loons coming into her harbor in the winter and dying of lead poisoning from lead shot in the water. She closes with, "I tell you this to break your heart, by which I mean only that it break open and never close again to the rest of the world. I love that. I think it's helpful for us managing the intense emotions that thinking about climate change can bring. Um, the American Psychological Association recognizes eco-anxiety as a real thing and a real source of distress for many people. And they note, to compound the issue of eco-anxiety, the psychological responses to climate change, such as conflict avoidance, fatalism, fear, helplessness, and resignation, are growing. These responses are keeping us and our nation from properly addressing the core causes of and solutions for climate change, and from building and supporting psychological resiliency. We need to recognize and resist these psychological defenses. When we feel grief and we feel fear, feel these feelings and let them lead you. Let them break your heart open, right? And then let that open heart fuel your curiosity and your concern and your creativity. Let it protect you from feeling numb, from denial, from fatalism. It's that creativity and that openness that is really going to help us, right? A professor at the University of East Anglia noted in a paper in 2009 that all of our societies can adapt to climate changes, but how well we adapt depends on how well we're able to act collectively. And I think in our experience right now with the COVID-19 epidemic, we've seen some places where we're really good at acting collectively and some places where we're really not. And we need to lean into that and find the parts of our community, those characteristics of our community that help us develop resilience to disasters. And those things, those aspects of a community that show that we have high resilience are things like social cohesion, things like political engagement, like voting, neighborhood socialization, feeling attached to your neighborhood, feeling a sense of community identity. We can strengthen our ability to overcome major climate disruption by voting, by going to block parties, by connecting with our neighbors. We need to address the physical vulnerabilities of our communities, right? We need to protect that physical infrastructure, and we need to recognize and nurture those human connections. And you and I can start that by meeting our neighbors and building those relationships right now from 6 feet away, right? Reach out virtually, leave a note and a loaf of banana bread on a neighbor's porch. Start building those connections. And that's how we build a community that's worth protecting from these disruptive impacts of climate change. There are a lot of other things that we can do to increase our own personal climate resistance and to resilience, and to increase our community level readiness. And some of that is basic emergency preparedness, right? Some of this basic kind of knowing how to protect yourself from tick and mosquito bites, thinking about those healthy practices and sharing information with others. And if you're making home improvements, right, consider how you can make your home more energy efficient and more ready for things like power outages or high heat or poor air quality. Some things that we do, like tree planting, like investing in solar panels, lower your carbon footprint, make your neighborhood a little bit more resilient to the impacts of climate change, and make our world a better place, right? Solar panels will ultimately reduce your bills, your electric bills. Trees provide shade and beauty and lower your carbon footprint and lower the heat island effects that we see. I was going to go back and share my screen one more time to show, have a little bit of discussion about the work that Department of Health is doing. Go back to this. Here is our climate team. And a year ago, we went from having one person dedicated to climate and health to having this crackerjack team. And honestly, if I were going to put the fate of the world in the hands of any particular team at Department of Health, this is definitely it. These are the folks who have been presenting to groups like local boards of health and community organizations and emergency planners, right, around how we can do the work that we need to do to build that community resilience and work together to make changes in our infrastructure. We're looking at climate data and indicators on the Washington Tracking Network. We're addressing these big gaps in our those foundational environmental health services, and at both the state and the local level. And we're excited about what we're seeing in the legislative budgets coming out so far. Just hopefully we will be able to get some additional foundational money to address much of this.
We're not seeing your screen. If you are sharing it, it's not showing.
Thank you for saying that. This is the one I want, and then I hit share. And it says I'm screen sharing, but nothing is on that screen. Now, do you see my team?
Yes.
Nice, thank you. Thank you for pointing that out. Another one of the big things that we're doing is providing technical assistance and guidance to all kinds of local authorities and partners on how to be better prepared to and resilient to those potential impacts of climate change, like wildfires and harmful algal blooms and things like that, but also how to make those changes in a way that creates greener communities that are more resilient. I will finish by telling you today about Paradise, California. The 2010 census, whoops, now that I've stopped sharing my screen, I've lost my thing. There we go. The 2010 census said that there were about 26,000 people in Paradise, and that's a little bigger than Silverdale or Moses Lake. They're 90 miles north of Sacramento in the foothills of the Sierra Nevada. Lots of beautiful trees, cooler summertime temperatures. Sometimes it snows in the winter. Every April, they hold Gold Nugget Days, a community celebration with a parade, a costume contest, a spaghetti feed, and a Miss Gold Nugget pageant. These days celebrate the day in 1859 when a 54-pound gold nugget was found. They have an outdoor skating rink they call Paradise on Ice. Arlen Hudson loved this town so much, he made it his mission to make a difference in Paradise every day. And he worked tirelessly for many years to improve Paradise through his volunteer efforts. Arlen passed away in October of 2014. And in his honor, the residents of Paradise come together every year in October to coincide with National Make a Difference Day to make a difference in Paradise. On November 8th, 2018, the Camp Fire burned through more than 200 square miles. It was the deadliest fire in Californian history and the deadliest wildfire in the US in 100 years. After burning through rural communities in Butte County, an urban firestorm formed in the town of Paradise. A firestorm is a fire that gets so intense that it creates and sustains its own wind system with its own storm force winds from every direction. When firestorms have occurred in cities, it's usually been as a deliberate effect of explosives like fire bombings of Hamburg and Dresden or the atomic bombing of Hiroshima. Heat from the fire can melt asphalt, metal, glass. It turns streets into flammable hot liquid. The high temperatures ignite anything that might possibly burn until the firestorm runs low on fuel. This fire killed 85 people and destroyed 18,000 structures, with most of that damage coming within the first 4 hours. A year later, just 2,000 people live in Paradise, less than 10% the size it was in the previous year. One Paradise resident, Jesse Mercer, told a reporter, "I lost every one of the houses that I've ever lived in. I lost my school and any job I've ever worked at. 19,000 of my friends who I used to live with are now living elsewhere. There's no signs, there's no streets, there's no buildings." I tell you this story to break your heart, by which I mean only that it break open and never close again to the rest of the world. Let that open heart protect you from numbness and denial. Let it fuel your curiosity, your concern, and your creativity. And let it connect you to people and draw you into meaningful and productive conversations about this beautiful world we live in and about our work to protect it. Thank you.
Thank you so much, Lauren. Oh my gosh, yes, we all need our heart to open and our minds to open to try to embrace these things. So thank you both for for your presentations. Now we will have some questions, and since I'm the face here, I get a chance to ask the first question, maybe one of both of you. So the first question I want to pose to you, Lauren, is you've described that there is a team, a state team that in fact is working on a variety of different issues. Can you tell us a little bit about how they're working with local governments, and are there funding sources that are helping that work happen?
Yeah, I'm very hopeful that we will start to see more funding sources coming in. I know the team is working on applying for a grant from the Centers for Disease Control and Prevention. And hopefully that will bring additional resources in. And I'm hopeful for the Foundational Public Health Services that the legislature is contemplating right now. And as that funding comes in, I'm very hopeful that we'll be able to support local health in more climate work. What we have done at the state level is make some tough decisions and say that climate change is one of the most important things that we have to deal with right now. And that means we are going to not do some other things, and we're going to move that funding into climate. And that is how we grew over the last, about a year ago. We moved some of our other activities we just stopped doing and dedicated that work and that effort and those resources to climate change. I think that is the right thing to do, but it's not the right thing to do to have public health funded to the extent that we have to stop doing important things to start doing other important things, right? But this team is partnering with local health and with other community groups to help do climate assessments in that community, right? Like as Dr. Ebi talked about, there's different impacts in different areas, right? Not everybody is going to worry about sea level rise. And that's cool if you don't live on the coast. But the communities that do need to think about that in terms of their climate assessment. So we provide data that we have access to. We put that on our Washington tracking network for communities, and then help them look at that data and other information that they have about their communities to think about the local impacts and how they can work with their community planners to build those communities that are both healthier and greener and more resilient to climate change.
Thank you. And quickly for Dr. Ebi, you talked about in your presentation that it's so important that there's information that the academic community is creating that would be very important for public health organizations to know about. Can you share with us if you're aware of relationships beginning between like UW or other academic agencies and health organizations?
It's a great question, and thank you for asking that. I'd like to start first by underscoring one of the points that Lauren made so well. Is one of the challenges we face is the really restricted amount of funding. Everybody always says there's not enough funding. When you look at climate change and health, and I'll work from global down to national, there's major funds under the United Nations Framework Convention on Climate Change to help low and middle income countries adapt to a changing climate. And there has been more than $1 billion put into those adaptation efforts, and less than 1% has gone to health. When you look at the research funding that under our National Institutes of Health, the funding for climate change and health has been about 0.04% of their budget. That's also true in Europe. It's true in most major countries. It's changing right now, fortunately, in Canada, and it looks like it'll change in Europe. There's been no money. CDC gets a tiny, tiny, tiny amount of money every year to work on climate change and health. And they've been working with, Lauren, is it 14 or 18 city, state health departments. That's a tiny fraction of our health departments. We don't have the money. And that is a critical issue that needs to be addressed. So sorry, but I really had to put in there that it's not that people don't want to, it's that it's just really, really hard when you don't have funding and you have all kinds of other priorities you have to address. So we need to keep that in context. And with that, I've completely forgotten your question. So if you could pose the question again.
Just quickly, relationships between academic and government organizations.
There's lots of them, and they've been well established. I mentioned the National Climate Assessment is a very important activity in the United States. There's chapters for human health in all of the assessments. So that's one place to look. When you look at the organizations, the American Public Health Association has been doing quite a lot around climate change and health. They have people within the American Public Health Association working on this issue. They partner with academics. We've got ASTO, the American Association of State Territorial Health Officers. I almost got that right. Who's also been working on climate change and health for quite some time. So there's lots of partnerships that are out there. We come back to the fact that this is primarily volunteer activities. There's so little funding, and it just takes dedication of, you heard, rearrangement of our state budgets, so we've got some money here to do something in the state.
Thank you. Okay, now we've got a variety of different questions on the chat. So Anita, would you pose some of the questions from the chat?
Well, I have just one. It doesn't, oh, no, two. Can you hear me?
Yes.
Okay, good. From Catherine Pritchard, she asks, what are the salient talking points for opening discussions with people who do not believe in climate change or even in cause and effect? You've given us numerous bits of information, but this question is really about opening the discussion rather than offering too much information. You know, don't hit them with facts. So what do you?
I'll start that, and then ask for some help from Dr. Ebi. You know, unless you are Dr. Ebi, I would not recommend starting with models, right? Or a whole lot of facts, right? I think that's exactly right. It's certainly not anything that we have to do any homework for before having these conversations. This is just like in your community, like, what do people think about climate change? What are people thinking? Have they noticed things that are different, right? Particularly people born before 1980, right? What do you see that's different? I've been very surprised at the information that I learned. I grew up in Pennsylvania. I was born before 1980, but in Pennsylvania. So I don't know about the climate here, right? But I have heard from people who really are observing differences. You know, when I was a kid, we couldn't do this, or, you know, it was raining all, or whatever it was, you know, and that sort of opening is a really interesting opening. Gosh, I wonder what that's going to mean for, you know, for our kids, or I wonder how that's going to keep changing. I wonder, you know, wow, like tomatoes are doing better than ever. Must be because of our long summer. You know, I wonder what that means for our agriculture, for our, you know, continuing to feed our people. I think there are these little connections, and people won't hear information from just anyone, right? But from somebody who they connect with, somebody they trust, somebody they know. They're suddenly a lot more open, and they believe things, and that is a two-edged sword, right? Like, it means that I believe the stuff that was forwarded to me on social media from the people who I know and trust, and some of whom are not scientists, right? But it also means that if you're able to build those relationships with people, you really have the ability to help bring people along, right? And you don't have to argue about it until we all agree, but just like keep having those little conversations. What's important to you? What's important to them? And connect on those things. And I think that goes a long way.
Dr. Ebi, do you have a comment on the question?
I have a couple of comments. The first is, climate change is not a belief system. It's not a religion. We don't talk to other people about gravity. It's become hugely politicized. And so, number one, it's just not a belief system. And don't even worry about that. It's a fact. We know it. It's changing. We've got more evidence than anybody wants to hear about. The second is, if you're interested, there's a group in Yale that does annual reviews, or sometimes biannual reviews, of the American public and what we think about climate change. And it's called the 6 Americas. And if you put in 6 Americas Yale, it comes right up. And one of their recent reports is really interesting. So they do representative samples across the US. And 3/4 of Americans understand the climate is changing. As Lauren said, all of our hardiness zones for planting have changed because of climate change. People can plant things they couldn't before. They can't really get things to grow they used to grow. All of that's different, right? And so Americans know this is happening. And 2/3 of Americans want action on climate change. They think this is important. They think action should be taken. But only 30% of Americans are talking to each other. We are worried about climate change. We think it's important. We want action to take. We don't talk to anybody about it. And so, as Lauren said, these conversations are really important. And you can start with anything. Oh, look, my roses grew 8 feet last year. I wonder why. And they did. Why is that? I didn't do anything special. I ended up taking them out because they're just out of control. Things are different, and just talking about how things are different. There's a scientist who just went to the Nature Conservancy, Dr. Catherine Hayhoe, and she's one of the best communicators on climate change. She's also a very conservative Christian, and she has wonderful YouTube videos on talking about climate change. And she does this very, very well. So I would look up some of her YouTube videos and see how she's talked about how to start that discussion. And it doesn't have to be fraught. It can be 3/4 of Americans agree with you. And here in the state of Washington, it's probably more than that. And so don't be worried about starting these discussions. They probably share the same concerns that you have. And use that as a way to start moving forward. And it doesn't have to be everything. Here in King County, we've got the Green Globe Awards every other year. And they're wonderful. They celebrate some of the work that's going on with our NGOs, some of the individuals in the county. There's all kinds of places that you can connect with people who are concerned about our waterways, who are concerned about what's happening with our salmon. There's lots of ways that you can engage with other people and have those discussions, knowing that they share deep concerns just as you do.
Thank you. Anita, another question?
Yes, from Pam Hammond. With all the storms happening, is there enough climate change information discussed in the local media of why it's happening?
It's a really good question, and it's been an issue in the science community for quite some time, that there is a difference between weather and climate. They're on the same continuum, but there's differences. And that's important because the climatologists are the ones who study how our climate is changing. Actually, our broadcast meteorologists don't necessarily have a lot of information about climate change. Mm-hmm. And there's been a big program to try and train the broadcast meteorologists to better understand climate change. And so we're starting to see that with our broadcast meteorologists. And there's a PBS special that came out several years ago talking about climate change. And I've forgotten the name of it. It's a 2-hour special, really well done. And it focuses on a broadcast meteorologist from Oklahoma who really thought climate change has got nothing to do with anything he ever talks about, and talks about how all of the extreme events really changed his opinion, and how in his broadcast now he talks about climate change, and so that he's better communicating to the people that he serves.
In relation to that, I'm curious, I want to follow up on that. Are you seeing sort of a multidisciplinary scientific group of folks getting together to work on this issue? I mean, I'm thinking of meteorologists in relation to climate scientists, modelers, to public health folks. Are there that synergies starting to occur?
They've started some time ago, and because you asked, just about 10 days ago, there is in the National Academy of Sciences, Engineering, and Medicine, a committee that advises our US Global Change Research Program. There is established in 1990, this US Global Change Research Program that is supposed to help coordinate research across the 13 federal agencies working on climate change. And the report that came out 10 days ago very strongly recommended exactly what you're saying, that we do have a lot of multidisciplinary, interdisciplinary, transdisciplinary research, and it's not enough. And we need to partner with communities to make sure that the information that is generated is useful, usable, and easily used.
Thank you. Anita, do you have any other questions?
I have one. In discussing climate change with our more conservative representatives, I'm finding there's a real blank wall of denial and of protesting anything that has to do with raising taxes. Michelle Collier, our local representatives, said that Olympia is awash in money, and that she really strongly disagrees with any kind of tax increases, because obviously there's too many taxes. How would you address something when you are in a community that is so conservative and continuously votes in people who deny science and deny the need for any kind of tax change?
We've missed a real opportunity in the discussion in our state. There is a growing body of research estimating the health benefits of mitigation policies. And when you look at the health benefits, when you look at, we don't have to worry about coal-fired power plants, but when you look at reducing avoided hospitalizations, avoided premature deaths from exposure to what comes out of our tailpipes, having people eat the kind of diet their doctor recommends. Across America, we eat far more red meat than our doctor recommends. There's so much research on how good that is for our health. We can reduce heart disease, we can reduce stroke, we can reduce cancer. And you start estimating the benefits for our health. Overall, those benefits to our health are the same as the cost or exceed the cost of mitigation. We should be mitigating for our health, getting people out walking and biking, all those bike lanes that are being put in so that people can make short trips on their bicycle and not get into their automobile. There is so much research showing that it really does benefit all of us. It reduces our healthcare costs. It makes us feel better. We do activities together as families, reduce blood pressure, reduce reliance on medications. We should be doing this for our health. And that message has not come through very well in all of the discourse we've had around trying to mitigate. And if it comes in, we might be able to change the conversation.
And in a sense, going back to Lauren, it sounds like that's sort of a question or a request for the state health department to start getting that message or being able to calculate and articulate those benefits. Is that something that you see beginning to happen through your agency?
Yes, absolutely. Looking at those, there's lots of different things that we can do to reduce either our greenhouse gas emissions or to mitigate some of the impacts that we're seeing, and finding the ones that have the most co-benefits, right? That also benefit your health. Those are the places that we want to start, right? So making green communities that are resilient to climate change, loving the bike lanes, right? Like the electric bikes, right? Like electric cars, we talk about quite a bit, and electric cars are definitely good for the environment and good for you. And electric bikes take that one step further, where it extends the reach of a short trip, right? Because you have a little help from the bike, and you don't have to be worried about the hills that are coming up in front of you. That's a great intervention, especially with the physical infrastructure in the community, right? Making sure we've got safe bike lanes. Then that's something that's good for your health. It's good for the environment. It's fun, right? Those are all great. Those are all great things. I think the other answer I would have to the talking about climate change when people don't want to talk about climate change is thinking about severe weather events that we have experienced, right? Droughts, floods, wildfires, smoke days. We all hated the smoke days, right? Especially when we weren't even supposed to, we both weren't supposed to be inside and outside. So like that was awful. And I think remembering that, and what can we do to make it better when that happens again, right? Or how can we prevent that? Like what can we do? Those questions may have a little bit more salience because they're more concrete and they connect directly back to something that we've experienced.
And Lauren, that reminds me to add to those excellent points is to think about how to bring in other issues that are of importance. So equity is really important for our state, and collectively we've got strong values on reducing inequities. And I know that in Canada, one place that was discussing having some kind of a carbon tax had a discussion about what to do with the money. And one of the discussions they had was to reduce the cost of the access to the internet. Because if you can reduce that cost, it differentially helps poor communities. And that it's a way to help poor communities. You know, it helps all of us to some degree, but it really helps poor communities more. And to think about other issues that are really important and to bring those in. And you're right, start talking about the weather. The weather's different, we all know that. Start talking about gardening, start talking about fishing, start talking about activities people enjoy, bird watching. There's lots of ways to engage in this without coming in directly on climate change and trying to connect with our values.
One thing I noticed is that talking about ticks on dogs are really important to dog owners, which so many of us are, because it really does increase the number of ticks and obviously mosquitoes, which, you know, that could be a drill down point for a number of people.
Yeah. Anita, do you have any other questions?
Yes. In thinking about action and what we can do, I have wondered if a useful starting place for community engagement is in relation to disaster preparedness and using disaster recovery planning to work with communities to envision the solutions for future resilience and sustainable/renewable infrastructure we need. I'd love to hear any remarks about how organizations like the League of Women Voters, government, and academia could be positioned to help support community engaged planning for sustainable, equitable, low carbon disaster recovery planning. This is one, and then the person adds a link to a book, I think it is, on say healthy, resilience, and sustainable communities after disaster strategies, opportunities, and something else. Can't see it. So anyway, that's a long one.
Lauren, do you want to start?
Sure. Yeah, I think that's definitely a great place to start. Environmental public health in I want to almost say a normal disaster, but all I really mean is like not a pandemic, right? Generally, environmental public health comes in at recovery, right? Because the earthquake has occurred, the flood has occurred, and the waters have receded, and now we have to figure out what happened to our wastewater, what happened to our drinking water, do we have mold, or is our infrastructure, right? And in that recovery, right, in that kind of recovery from a disaster, we definitely need to be thinking about the infrastructure we want to build, right? Like, don't just put the road back exactly the way it was. Put it back with bike lanes. Put it back with things to slow down cars for pedestrians to cross, right? Like, put it back better. And those are, opportunities, really. Like when we've had that kind of disaster, that is the opportunity to really redo some of the infrastructure that we want to do. So knowing what that would be, like knowing what the infrastructure you would want is an important first step to that. And yeah, having that be a part of your disaster planning, I think makes a lot of sense. I also think that in the pandemic, but it's a little bit more abstract, right? But when we think about the new normal, that's that recovery time, right? Internet. Oh my goodness, our kids had to go back to school in our rural areas way before they had to go back to school in the urban areas. And that didn't have anything to do with COVID. It had to do with internet access. And we just like, my kids could do it. Like, you know, they're like happy to be back in school. So we like love that they're back in school just a couple days a week now, but we were able to continue with education on the internet, and that kept them safer for a longer period of time. Where communities didn't have the ability to make that choice were the places that we didn't have internet. So, right. So like what of the new normal what in our recovery needs to come forward, right? And I love the idea of thinking about internet. And I think there are other infrastructure things that we maybe have more, maybe we value more, right? Like maybe we've taken more walks and been more irritated about the sidewalks that aren't there, or we've, had more opportunities to, I don't know, to think about what we would like. The other thing I always like to say, and now I've just gone off my own little rabbit trail here, but we shut down the entire world and we still didn't have the level of reduction of greenhouse gases that we would need to meet the Paris Accord. So we will not be able to Zoom or telecommute our way out of the climate crisis. There are other things that we're going to need to think about, right? The ways that we manufacture things, the ways that we heat our world. There are other bigger policy changes that we're going to have to think about, and all of those good things, right? Like traveling less, electric cars, electric bikes, all of that stuff is good, and it is part of the solution, and it does make our world better. And we are going to have some really hard conversations about some other infrastructure and manufacturing that we have today.
Thank you. And Dr. Eby?
Yeah, I'd like to go back a second to the question. Humans are really bad at thinking about the future. I like to go back. There's this lovely quote. Maybe his name was Watson. He was president of IBM way back when. And at one point he said the worldwide market for personal computers was 10. And when my kids were at home, I think I had all 10. We're bad at this. And so there's a process that we're trying to encourage people to undertake when you think about disasters, for example, is do stress testing. It's not that dissimilar to the war games that are traditionally done in the military, where you set up a situation to get people out of, yes, we need to recover, but they can't really imagine the next disaster being bigger, being much more extensive. And many of the plans that are being put in place now for recovery are still not envisioning a very different future. And so there really has to be encouragement of, yes, we need to do this when we're doing recovery, and we need to think about what it's going to look like in a world that's warmer than now, more humid. We're going to have a lot more heavy rain here. We're already seeing water spouts in downtown Seattle. How are we going to transition infrastructure in ways that will handle a very, very different future? And so we do have to add that complexity of, yes, engage with scientists, engage with the variety of groups around. The University of Washington has a climate impacts group that's happy to talk with you about the kinds of changes you could see in your community in terms of weather patterns. And it's going to be beyond what you can imagine at the moment. I also want to go back to just a second. I think we missed a question from Anne saying that this is such a big issue. What can I do? And the answer is yes, it's a big issue. It affects everything. Start with what you care about. That no one person is going to solve all of this. It's going to take all of us working together. what really impassions you? What do you really want to work on? And start there. And when all of us take that on individually, then collectively we're making a difference, that we can see real shifts in our societies from our collective actions. And that's one of the real positive hopes here with climate change, is the more people engage, the more we're going to make a difference. 10 years ago, you never would have invited me to talk with you. I'm just thrilled that you're so interested and you want to hear from us today. And take that forward. There's all kinds of things you can do. The opportunities are endless. Choose the ones that you think will be the most fun, the most interesting, the most enriching. And you'll soon find that you've got others working with you and you're making a change.
Thank you.
Wonderful messages. Wonderful messages for us. Anita, do you have anything else you'd like to ask in particular?
Here from Pam Hammond, she says, why do you think there is so much resistance to facing the importance of climate change? Do you think it has become, unfortunately, political?
I'll go with entrenched interests. It's the same question of why can't we get gun control in the US? 90% of Americans want gun control. 75% of the members of the National Rifle Association want gun control.
Yeah. Yeah. Lauren, do you have any comment on that one too? Seems like the entrenched issues are or entrenched positions are the issue, but.
Yes, I think it does become political, right? I think it does. And from a public health perspective, I think we do some hand wringing around that. Like, how did this become political? It was just science. How did that happen? But public health is a governmental function, and public health policies are political, right? Like it just kind of is a part of it, and it's a part that we've been fortunate enough not to have to wrestle with on a lot of different things, but we've got our stuff, right? Like the COVID-19 response, climate change, people who don't want to be regulated for anything, right? We'll argue about regulations that may seem, reasonable to others, right? Like septic tank regulations. We have quite a few people who will argue that they don't want their homes to be regulated like that. And it's part of, I think politics is part of being a governmental function. And it's part of engaging with the public. And it's not, it's frustrating when people don't agree with you, right? And they don't want to do what you want to do. That's totally frustrating, but it's not necessarily distasteful. It's what our process is, and it's set up that way on purpose to slow down government action, and it works.
Well,
it doesn't have to be so political.
No,
it doesn't have to be. And so thinking about the role of the League of Women Voters, for example, the governments that make up the United Nations Framework Convention on Climate Change have an annual meeting. It's called the Conference of the Parties. And the last one that was held, there were 4 television stations from Bangladesh that paid their own way and spent all day, every day in this meeting with 15,000 people, interviewing people about what was going on. And they broadcast every night to Bangladesh about what was going on in this meeting. My friends in Bangladesh said the average citizen in Bangladesh was more informed about what was going on in that meeting than any of the citizens in the high income countries. They really understand these issues. And so there are lots of opportunities through what you do to educate people about issues. There's a diversity of opinions. For public health purposes, we want to make sure we regulate septic systems. You don't want other people to get sick. And that is a way that you can reach out and make sure that people are informed, because ultimately what is going to matter is how we vote. And we need to vote our conscience. We need to vote our values. We need to make sure that our representatives will go into our legislatures and make sure that our values are represented and that the actions that are taken do represent what we want to have happen.
Yes, and with that, the League of Women Voters thanks you both for this wonderful day of thoughtful discussion. And we certainly agree with your last point that we all need to be active and educated participants in our government. So thank you so much. Thank you everyone listening. And we appreciate you attending, and we hope that you'll attend future presentations. And again, you can see a recording of this event in a few weeks on our website. Thank you.